Thus far, the pandemic has created so many problems for the United States and for other parts of the globe. And we are still seeing the ripple effects of what COVID managed to do 8 months ago today. We are seeing how big cities like New York, Seattle, Los Angeles are being completely consumed by economic shutdowns and small businesses permanently being closed. We are seeing how local communities and even rural parts of the country, like Iowa, South Dakota, as we are seeing across other parts of the world, their hospitals are being overflowed with patients. So the pandemic thus far has not shown any signs of slowing. In fact, if anything, it has shown its mean teeth on so many levels. And we are seeing how this winter, at least in the Western Hemisphere, is expecting to be a very dark one. The United States is already experiencing the early stages of a dark winter. We are seeing hospitals being completely overrun with patients who require oxygen and steadfast medical treatment. And medical staff, as well as hospitals, are working on many different fronts to confront this crisis. I know that many of my colleagues have reached out to other parts of the United States, asking what their best practices have been. I know that organizations are trying to coordinate and rebuff their protocols so that the transferring of patients can be more seamless. And so physicians and other practice providers can connect with patients out in the communities using telehealth. So there has been a real push into innovation, which is actually quite exciting, because now more than ever is the time to actually look into these alternative forms of care delivery. And so there has been a more seamless transition and a more focus on data and science and coordination with other health systems in other parts of the country who have already suffered from initial waves of COVID-19. They have all been talking and collectively trying to come up with new ways of sustaining the mental health of the medical staff, as well as the safety and well-being of the communities in which they serve. President-elect Biden and his administration will really have to tackle the crux of how do you balance economic uncertainty with health-related uncertainty? How do you align incentives across the board so that everyone continues to take care of themselves and that we, as a healthcare, can treat as many people as possible? The stakes couldn't be higher right now. In the United States, we have over 11 million cases of COVID-19. We have almost 250,000 deaths from the virus. How are we going to come together, and how are we going to work collectively on dampening that figure? That is going to be the million-dollar question, and the answers have to come from this new administration, because we are starting to see how this virus is not relenting, and this virus will come at us harder and worse than it ever has.